Namaskar viewers, welcome back to the channel Homeopathic Medicosis #Homeopathy for all. And today's thought is just be clear, just be happy, and keep everyone around yourself happy. So this is a basic motto for today. And further moving ahead of the previous video discussion, this is getting recapitulation about the previous video, that is NUX vomica, poison net, common name families Lobniaceae, and characteristic symptoms of the NUX vomica, that oversensitiveness, that chilliness, that nervousness, the spasm, that morning aggravation, that mental picture overview if you will get that, or that oversensitiveness, that impulsive nature, that malicious nature, that is workaholic. NUX vomica is workaholic, you can say that cannot bear contradiction, touchiness, easily excited or angered, impatient, hurried, disposed to quarrelsome, malicious, and violent anger with anxiety, and there is lots of confusion of mind, and cannot bear the contradiction as I spoken earlier, and craves for stimulants to keep himself or herself active. So this is the basic recapitulation, and now we moving ahead to the evolution of NUX vomica mental state. A NUX vomica mental state basically understood by, give an example, a businessman who is very aspirational, who wants a lot of possessions and money. For that he works hard, he works relentlessly without taking care of his body, his mind, suffering from lack of sleep as well as improper diet. Slowly mind and body start exhausting, and with that comes nervousness. Now he cannot bear the pressure of work, thus having a lot of stress related to his occupation, business, always keep thinking about his business, thus lost his calmness, lost his peace, lost his sleep. तो इस तरह से जो है काफ़ी ज़्यादा परेशान होने के बाद वो एक रास्ता ढूंढता है. सो ही or she takes the support of stimulants of various kinds of coffee or alcohol or aromatic medicines, of craves for stimulants to recharge himself. This is the rubric by Kent, that craves for stimulants. NUX vomica patient basically craves for stimulants. So marked melancholic, then wants to commit suicide but afraid to die. Marked hurriedness, does not able to sleep, prostrated, sleep by fits and starts, चौक के उठ जाना रात को, wakes at 3 a.m. and his mind got crowded by affairs of his business. This is basically the patient suffering from general anxiety disorder. This is a basic symptom of a patient suffering from general anxiety disorder, to get at 3 a.m. and just get crowded, mind get crowded by the affairs of the work or related to his business. Now moving ahead with the physical generals of the NUX vomica. So this is from, we will move ahead for this video. So यहाँ से हम आगे बढ़ते हैं. So NUX vomica में बेसिक एलिमेंट्स जो हम पहले भी डिस्कस कर चुके हैं कि फ्रॉम स्टिमुलेंट्स, जो कॉफ़ी से है, टोबैको से है, अल्कोहल से है, नारकोटिक्स से है, ओवर ईटिंग, दैट मीन्स दैट बहुत ज़्यादा खाना, कोई अच्छा खाना आ गया सामने तो बहुत ज़्यादा खा लेना और प्रॉब्लम, उससे पेट फूल जाना, ब्लॉटिंग एंड लॉट्स ऑफ indigestive food symptoms coming way, and consuming highly spiced food, sitting on cold stones, sedentary habits, and oversensitive physically and mentally, pains, tingling, sticking, hard, aching. So that aggravation by motion and touch, this is the basic symptom of all the pains in the NUX vomica, that aggravation by contact and motion. Tendency to faint from orders in the morning after eating, from labor pains. So there is general tendency to faint in the NUX vomica from pain. Moving ahead in the NUX vomica, we will see how there is presence of the hyperesthesia in every symptoms. There is a sense of getting excited associated with every physical symptoms. There is NUX vomica patient is emaciated, weak, and desperate to lie down. There is hyperesthesia of all the senses. That means the person is very sensitive to the external sound, external touch, external orders, that any kind of we can say that there is jerking and twitching the body, the general excited general excited sensation, it is general excited sensation present in the body. सो दिस इज़ द बेसिक फिजिकल ओवरव्यू, यही एक बेसिक फिजिकल ओवरव्यू हम देखते हैं नक्स वोमिका पेशेंट का। इसकी मीनिंग सिंपल है कि ऐसे फिजिकल कैरेक्टरिस्टिक्स या ऐसे फिजिकल सिम्टम्स जो पूरी बॉडी को कवर करते हो, ना कि एक जनरल पार्ट्स को, एक पर्टिकुलर पार्ट्स को। सॉरी, डिज़ायर फॉर स्टिमुलेंट्स, फॉर हाईली स्पाइस्ड फूड, loves fatty food. So these are basic desires for nux vomica patient. These are basic desire when he is in the evolutionary phase to convert into a nux vomica patient. So aversion to bread, sour food, though loves stimulant, but that general aversion will be developed. Tobacco from exercise and open air, appetite, ravenous anger, but just a day before of dyspepsia, thermal reaction is chilly patient, and sleep, falls asleep in the evening but remains awake after midnight, especially at 3 or 4 a.m., and bad effects of loss of sleep. And there is a stool. So sleep is basically that it is inverse of or just opposite of pulsatilla sleep. Pulsatilla is basically sleepy in the morning, but he does not able to sleep, or he or she does not able to sleep in the evening time, in the night time, went into bed and feels awake. So this is, and stool is very characteristics of nux vomica. Ineffectual desire, constant effort to pass the there is a constant effort to pass the stool. So this stool symptom is basically due to the irregular peristaltic movement of the intestine. So this is because this is all about the generals of the nux vomica, physical generals of the nux vomica. Moving ahead in the particulars, first we will take the head. There is congestion, there is vertiginous heaviness, there is hemicrania of coffee drinkers, feeling as if nail is been driven through the vertex. This is same like ignatia and coffea, very easily affected by little cold, mostly from the dry cold wind, and get worse mainly in the morning, waking in open air, especially in sunshine and on mental exertion. Feels better in warm room by resting, lying on back and painless side. So it is feels better by lying on back or painless side. It is opposite to pulsatilla and brainia. Pulsatilla and brainia likes to sleep on the painful side, likes that pressure, as it is hyperesthetic. So it is sensitive to touch, sensitive to pressure. So that's having aversion to sleep on the painful side. There is a not a particular part is assigned to nux vomica headache. It is all general headache, all having general head, covering all the parts of the head in headache. So this is the basic thing. Next moving ahead to the face. So फेस में हम आगे बढ़ते तो फेस इसका पेल होगा, येलोइश होगा, येलो अबाउट नोज एंड माउथ और आईज, लिप्स peel off and scruffs on the lip. There is peeling of the lip as it is a dry, swelling of one cheek. So this is the basic face symptom that we can see in the nux vomica. Stomach में देखेंगे कि spasmodic, now the term again comes, spasmodic, colic and pressure which extends to the interscapular region when fasting in morning or after eating. The spasmodic colic of brandy and coffee drinkers, disorders from overeating, disordered pit which pains from slightest touch, indigestion after taking cold. So nausea होगा morning में और after eating. Rancid heartburn खाने के हालांकि 2 घंटे बाद नक्स वोमिका में सिम्टम डेवलप होता है. पेट में जलन, नोजिया फील होना, नोजिया in the early morning or after eating both is seen, and vomiting and disordered from overeating, feels better after hot drinks. So nux vomica patient likes hot food and drinks. So this is the basic symptom of the nux vomica, just like lycopodium also likes hot food and drink. Abdomen fullness is there in after eating, constriction of upper part. So abdomen symptom is very very important, because this nux vomica though is a very important polycrest, but most of the time it is given for the complaints of the related to the abdomen, liver, and stomach. So abdomen is basically, so in abdomen there is it will cover everything, stomach and liver. So yeah, moving ahead, fullness in after eating, constriction of upper part, very sensitive especially to the slightest touch, and intolerance of tight clothing around the waist. So पैंट को लूज पहनना पसंद करेगा, बेल्ट को ज़्यादा टाइट नहीं करना पसंद है, क्योंकि देर इज़, as we can already have spoken about that, there is sensitiveness of the touch, so there is present in around the waist too. So there is inflamed indurated liver, colic from taking cold, bruised painfulness of muscles during motion, coughing, laughing, and toothbrushing. And there is stool, as we have discussed earlier. There is ineffectual urging, constipation alternates with the diarrhea and ineffectual urging just because of that irregular peristaltic movement that is present in the nux vomica intestine. So respiration, there is again that word, spasmodic or suffocative attacks from spasmodic constriction of larynx after midnight. So there is again the word spasmodic constrictions comes into the use in nux vomica. And then constriction of lower part of the chest, asthmatic attacks, coughs very laborious, excited by tickling in hard palate and larynx, dry and mostly at night or early in the morning. Dry cough, there is very little production of mucus, so there is non-productive cough, it is dry cough. So expectoration of yellow or grey color, generally sour or bitter, putrid, metallic taste. So the taste associated with the nux vomica is either sour or bitter. Sour is most prominent, bitter is for pulsatilla, is also there is bitter pulsatilla. So taste with bursting headache and bruised feeling in abdominal muscles, catarrhal hoarseness with a scratching in throat. And this is all about the nux vomica respiratory symptoms. Neck and back, very peculiar back symptom is lumbar ache, lumbago. Ache as if breaking, must sit up in order to turn in the bed. बैक पेन ऐसा हो रहा है कि उससे रिलीफ पाने के लिए बंदे को बैठना पड़ेगा, और उसके बाद जो है अगर टर्न करना है तो बैठना पड़ेगा, और उसके बाद ही वो अपोजिट साइड में टर्न कर पाएगा. एंड द बैड इफेक्ट्स ऑफ द सेक्सुअल एक्सेस इज आल्सो नोटिस इन द बैक एक. सो फीमेल रिप्रोडक्टिव सिस्टम symptom is menses profuse, early and prolonged, intermittent, discharge of dark lumpy blood, dysmenorrhea, cramps extends to the whole body with constant urging of the stool and urine. So जब labor pain हो, so that will be also like this, so that urging to the stool and urine will be there. Inefficient labor pain, though it is faints at every labor pain, and profuse bleeding after basically abortion. So all the old symptoms after menses and came up, all the old physical symptoms, so the body symptom associated with different parts of the body, that will came. And painless gathering of milk in the breast and from not nursing the child. अगर नर्स नहीं किया जा रहा है चाइल्ड को, दूध नहीं पिलाया जा रहा है एक इन्फेंट को, तो देयर विल बी accumulation of that milk in the breast in that female who had given birth to the child in such a way that it is painless, though it is a very disturbing symptom. So moving ahead, the fever of nux vomica is very peculiar. The chill, there is chilliness that we had discussed in the characteristic symptom. The chilliness is marked in all the phases of the fever, that is heat, cold and heat. So the cold, heat and sweat, basically in all the three phases the chilliness is marked and cannot uncover during any phase of fever because of that chilliness. So body burning hot, especially feel unable to uncover without feeling chilly. Pulse is hard and quickened, and especially during heat. And sweat is sour and it is one-sided sweat, and excessive rigor with blue fingernails. There is excessive feeling of chilliness with the blue fingernails is also present. So that is very peculiar kind of fever. In modalities, aggravation point is basically the early morning aggravation, open air, uncovering, excessive stimulant, sedentary habits, sleep, mental exertion, fatigue, vexation, anger, noise, odor, touch, pressure. These are all the oversensitiveness represented in aggravation. Amelioration by wrapping up, by resting, the hot drinks, hot foods, milk, hot milk, that is moist air, or lying on sides with painless sides. Basically lying on that painless sides will relieve the complaint of the nux vomica. This is the basic modalities, though few points are missing, but yes, uh, the more important points are mentioned here, that is most generally seen in the nux vomica patient. Moving ahead to the relationship is something that helps in the second prescription, or in the follow up, or in the failed first prescription. So it is complementary, means those remedy which will complete and enhance the drug action and remove all the side effect of the previous medicine given. And that is that the first prescription, if any former remedy having any side effect, it will remove and it will complete the action of the first remedy. Sulfur in all disease, phosphorus, kalicar, inimically zinc. And basically nux vomica should be given several hours before going to the bed to act best during repose of the mind and body. So this is the basic relation, and it is basically followed by the ars, follows well by the arsenicum and arsenics, that is, and ipecac, phosphorus, sepia. And these are the some few relation points I mentioned. Hope you had liked this video, and this is all about nux vomica. Thank you for watching. Thank you very much.